we do see pretty sophisticated players, if you will, in the airway education space that are driving very successful courses and programs through kind of a device first versus a diagnosis first approach. That's kind of scary to me. I always want us to be able to separate from that.
At the intersection of airway, sleep, dentistry, and whole body health, 3 leading experts come together for one evidence-driven conversation. Dr. Barry Raphael, integrative orthodontist and co-founder of the Airway Collaborative. Dr. Richard Stevenson, award-winning educator, author, and authority in restorative dentistry. Dr. Mark Cruz, respected lecturer, clinician, and contributor to National Dental Research, where science meets clinical insight. This is Airway Nexus.
Richard, how are you, my friend?
I'm doing well, Mark. Good to see you.
Good to see you too. Excited for another episode here. And what are we to talk about tonight, Rich?
Well, I happened upon an episode that was on one of the major news networks that was an expose on this social media trend called look smacking, and it really featured an influencer who has done a lot of things to himself and was talking rather casually about some pretty major surgical things too, like considering doing a Lafort advancement procedure. He had mentioned it was at $35,000, and it's all to make yourself look better. And so the commentator, they had one of the physician commentators come on and talk about this is, body dysmorphia, and they started commenting in that respect. And because we utilize surgical procedures, sometimes to the extent where the jaws have to be moved to help the patients, I wanted to talk to you about how we can sometimes be dragged into looking like these people. For example, it's really kind of my lesson of the week in some respects, but I think I want to talk about it now a little bit. But I have a patient that is undergoing treatment with me, and her daughter is a healthcare provider and is basically saying this is just a fad, and obviously has picked up on what's being done out there, not only in social media and more legitimate providers, and then also what people are doing to themselves. Patients walking in asking for treatment without understanding, the risk, perhaps, or why they would even get that kind of work done. And so I think I just wanted to define for our listeners clearly, separating where we're coming from and where these other modalities may be coming from, and how they're different. So do you see this self-treating kind of social media thing kind of bleeding over into the airway treatment world? I mean, are you fearful that we could get sucked into this as well? Either
Yeah, I mean, there's so much to unpack there in what you
yeah,
said, for sure. I call this the wild, wild west in airway. It's the media turmoil. It's the marketplace that is asserting itself into healthcare in a real way, where uninformed influencers are not really understanding, certainly airway. And I think there are two things here with that report from that influencer. And by the way, it's face maxing. So
fixed
maximizing,
maxing. Got it.
maxing, right? And so like bone crushing, and and some of this started with if you remember the mewing phenomenon that started
Right.
with Mike Mew, really talking about his dad, John Mew, who's now, passed away, where people would go on 20-second TikToks talking about how you can grow your jaw, and people understanding a little bit about myofunction, that you exercise and you can, increase muscle mass and make it look better, your face better. And it specifically, it was a demographic. It was young males, college age, high school to college age. I actually see them, and they call me, and I've sat down. I have a couple of those patients where we've sat down. So there's that, which is very different than Airway. There's a cross section there because form
Right.
follows function. And the reason why we teach our courses is because, not because we're afraid of being sucked in, but because we want to make sure that the provider understands that you can't really understand an airway focused approach to what you do as a dentist by a weekend course. And that's everywhere. As you know, we've talked about it. You have these quote unquote gurus in our profession that maybe know a lot about a particular, like a specialty or whatever. And they might partner with like a sleep physician, and then they'll talk about a widget, facial, skeletal expansion, palatal expansion, all kinds of different techniques that are just techniques in and of themselves. And so my concern is that we, as healthcare providers that are airway focused, are always about looking at health and wellness first. And so we could define what wellness is, but I could tell you it's different than not being sick. And so that begins with the breath, breathing easily 24/7. And we look at structural, functional, and behavioral risk factors. These are things we talk about. And in these particular domains on social media, they're not talking about that at all. They don't understand it. In fact, the commentator, the physician, well-known physician,
Mm-hmm.
doesn't really understand the problem either. He understands an aspect of the problem, that perhaps there's some dysmorphia there, and there are some psychological undertow, if you will, in that discussion. But talking about double jaw surgery, first of all, $30,000, please. If it's done right, you're looking at 4 times that to do it correctly. But even that, within the orthodontic community, this must be planned very differently than the traditional orthodontic approach. It's telescopic, and we get into the details of what to do in order to optimize airflow limitation that so many people have. Because form follows function, the size of the airway, the airway is the keystone of the face. The way the face looks is a reflection, a good reflection of the caliber and potentially the function of that airway. And this is what people aren't understanding, because what we see now is mostly our population is bimaxillary retrusive. And
Yep.
so we've talked about this in other podcasts, that it begins with an understanding of the anthropologic risk factor, right? So our faces, the way we are, not just our faces, our whole body is very different, is functioning in a very different environment now, today, circa 2026, as compared to where we were, say, 500 years ago, before the Industrial Revolution. How we're born, how we feed, how we breathe, how much we exercise, what we eat, as far as like not the content per se, but the challenge of muscle function and all those things that actually help us develop our Paleolithic face. That
Mm-hmm.
discussion is not even understood. It's not even on the radar screen. That's the elephant in the room. And so when I hear these discussions in national news now, to me, it's just more telling us how big thing has become. It started with lip taping, and then people being aware about, breathe rights and breathing through the nose. And then, you've got my pillow, you'll sleep better by using this pillow or that mattress.
Oh,
And
and the nasal cleaning hygiene thing is huge now. Navage is
all of
everywhere
that,
now.
those
Yeah.
are all driven by the marketplace. They're seeing some things that they don't quite understand. And I mean, I know that sounds arrogant to say that, but when you really understand the underlying issue that we talk about, structure, function, behavior, and how pervasive it is, it's a pretty serious discussion because it is largely responsible for the preventable chronic diseases that we suffer from that's making us sicker that we're trying to address with symptom driven care that we cannot afford. It's unsustainable. So, this is a huge political discussion as well. So, I would say that no, I'm not at all concerned of us getting sucked into it. I am concerned about our profession going down the wrong path because of financial interest.
Yeah. Let's talk about that for a second because our profession is quite diverse, and being dentists that have been focused on excellence our entire careers, the scholars, publishing, teaching, lecturing, looking at dentistry as a very sophisticated healthcare um, calling, if you will, that we've had. uh, we really sit in a place that allows us to see everything that's happening. And and once again, not to sound like it's some arrogance or something, but because of the journey, the trajectory we've taken as educators and so focused on our craft, we've been able to see what is happening in the world expanding below us, if you will, and where the motivations go from healthcare into top line, bottom line approaches, EBITDA, people buying up practices all over the place. And I'm like, wow, I have a hard enough time just with my own practice. I just it's just hard to imagine someone is buying their fourth practice or something,
Mhm.
and a young person because they somehow see that as the key to happiness or success or something. But you know, the, in all of that that's happening, we do see pretty sophisticated players, if you will, in the airway education space that are driving very successful courses and programs through kind of a device first versus a diagnosis first approach, I think. And I think that that's kind of scary to me. And I worry about that. I always want us to be able to separate from that. And I would hate to see people throw us in there. And you mentioned the 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 rapid entry into the airway provider identity through a weekend course, and I thought, well, gosh, what are they going to say about us? We have weekend course too, but we're very, very different because it's not just a weekend; it's a structured approach. We have an enormous amount of data that and learning modules that are required beyond the courses. We have ongoing study clubs that where we meet and treat patients. We have about every month or so we have a Zoom meeting where cases are discussed in great detail. I don't know enough about some of these other programs, but I don't believe that would fit into their business model to have that level of commitment. So I just want people that are listening to go, hey, what do you mean they have a weekend course? Well, yes, it is on a Friday, Saturday, Sunday, but it's a little different. Um, so anyway, I guess I wanted to say, where do you think that we draw the line between where we're at and what all this noise is out there in the airway education um, space? How do we let people know? I guess how do you
Well, can I jump
advise
in?
someone on how to find the right course for themselves
Yeah, yeah. Yeah, let me
or
jump in.
journey
Yeah,
path?
yeah, absolutely. Well, there is a lot of irony in what's happening right now that I I know, and I'll maybe even call you on this too. But as you know, I've been talking about this for 15 years before quote unquote Airway existed. It didn't. It
That's
was all about sleep medicine, like sleep growth solutions. These companies, the American Academy of Dental Sleep Medicine,
yep.
started really
Right.
bringing dentists into making widgets to address obstructive sleep apnea, which made the dentist basically the stepchild of a physician that was diagnosing based on the diagnosis of obstructive sleep apnea, maybe even snoring. And I never was interested in that. I didn't quite understand, and as I was connecting the dots, going back, at this point more than 15 years, I started putting little lectures together, as you know, on Airway. It was what I called Airway. There was another group in New York that was simultaneously starting to talk about it as well. And in fact, one of the individuals there wanted to sue me because I used a word like airway centric, which I had already gotten domains made, and owned it. But he thought it was his because he said airway centered, and so that's kind of where it began, back then, where different yet like-minded people were really looking at something beyond sleep. Although even then, in that group, it was pretty much focused on obstructive sleep apnea. So I know all the influencers or gurus, the tribe chiefs, if you will, that are teaching these courses now, that were telling me back years ago that what I was teaching was didn't have evidence, and that it was a fad and it didn't exist. I can name them, and I won't. I can name them, and now they're actually all in, and that's great. I mean, honestly, that's what I was hoping to do at some level, is to raise the awareness to where I wasn't this lone crazy guy with my partner that at that point then I met, Barry Rayfield, and we started giving these courses together. And you came to one of them early on, had to have
Mm-hmm.
been 15 years ago plus.
Mm-hmm.
And then I never really heard much from
Mm-hmm.
you about it, which was very, very common, because I think because it wasn't really a weekend course, it was more it began with some weekend courses, but it turned into a mini residency, 110 hours plus cases and everything. And I look back, and it was very daunting for the average dentist, because most dentists want to just be spoon fed, and what do I do on Monday, and then they can monetize it, right? This is
Yep.
very, very different.
Right.
So what's going on now is very akin to that. Like, let me learn something on the weekend, and I can monetize it on Monday, which that's not what Airway is all about.
Correct.
And so this is really a retooling of our profession and how we actually see the patient. And so what's happened then is then the public has started learning a lot of it from our work in the mini residency, talking about taping. And taping was not meant to be a solution, it was meant to be a test to
Right.
understand that we should be breathing through our nose. And if you can't tape them. But now you've got companies that are building these products, and now you got TikToks and influencers talking about you got to tape at night. And I mean, I'm hearing that from moms, but literally that was something that a long time ago. Nose cones and all these other things, talking about nasal expansion. And so I mean, I've seen it come full circle now, and honestly, I'm kind of excited that it's gotten to that point now. And a lot of the people that have gone through my program now are populating actually at the podium, teaching the stuff, but they didn't really do the whole work. And I take that responsibility, because I did not make it easy to really understand, well, how do you actually translate this into real world practice? That's what
Mm-hmm.
you and I are doing. And that's
Right.
why I partner with you as an educator, where you actually came back to me 2, 3 years ago. And if I can remember correctly, you were saying, "Hey, Mark, I'm hearing more and more about this Airway thing. I'm at these large meetings, and you know everybody as an educator all over, and people know you, and you were saying, gosh, it's like this keeps on coming up. I really, want to get into this, and I've had other colleagues like you that have said the same thing. That initially were like, okay, that's fine, and then they went on doing what they did, but now they're coming back because they can't ignore it anymore.
All right.
And so I think that's natural. This is part of the process in the marketplace. And I think as I see us and why we partner together is because we're about providing a solution to the profession, not just to the average Joe Blow, to the profession. I'm challenging our profession to actually change what we teach, what we've been doing for 100 years. It's got to improve because now it's been hijacked by commerce. And as has dentistry in general, you get private equity and coming up with the dental sleep organizations that have pretty much put solo practitioners out of business because they have economy of scales, but they don't really understand what we do as dentists, but they have a lot of money. And if you're graduating from dental school or from your residency with $350,000 of loans and you want to start a practice, this is very attractive. And so now it's all part of what's going on in healthcare in general, but that's a microcosm looking at dentistry. And then you throw in this layer of Airway. People are trying to figure it out. And I'm not in any way worried that they're going to figure it out and how to do it, other
I
than
don't.
just to do widgets.
Yeah, I don't think so either. But I do think that airway as it is at risk, certainly in of being a commodity. I mean, it really could be, and that scares me because it'll take a long time before every single one of those cases goes sideways.
But
As
let
you
me
said,
jump in right here, Rich. I don't mean to step on you, but let me jump in because
yeah,
it's what
please.
you just said is true. But really, it's not different than what's happened with veneers or crowns, right? It's
True.
been turned into a commodity. It's
That's true.
created a crisis in our profession, and the public has very little idea. You get these commercials on TV now in the evening. Come into my center and teeth in a day, or
Oh, yeah.
we could do a smile makeover, and they not even understanding that the lab work and is being sent overseas with really not a high level of precision and accuracy. Just kind of like what happened with clear aligners, where the specialty of orthodontics sued a company that was going out straight to the public and saying, just send us, we'll send you some clay, you take the impression, and we'll
Right.
make these clear aligners and you could straighten your teeth out. I mean, that's huge. That's the marketplace. But it
Right.
also happened with dental sleep organizations making dentistry a commodity, like a crown is a crown is a crown, right? And if it's covered by insurance and they pay X amount, why wouldn't you do it, right? It's nothing out of pocket, and yet it fails at a year or 3 years, or it creates other problems, leads to over treatment. But why should I go and spend X in a private practice that gives high-end dentistry that the fee is 1.5 times higher per unit, when I could go down the street, nothing out of pocket, and get the same service, the quote unquote same service. So I'm going to argue that it's kind of the same thing, but maybe at a higher level. And what makes it more dangerous is that now the stakes are really higher because it's more complex treatment, and because now you're really treating or dabbling in the medical ramifications, the medical comorbidities that can actually harm the patient. And so those are my concerns, because one of the things that we teach that's very unique, and I'll end on this little statement here to make it very clear: what we teach, what drives treatment, is not how the face looks and the profile and the size of the palate. It's really understanding the medical comorbidities, why you're sick, understanding that why you snore really has major ramifications for brain development, for Alzheimer risk, for cardiovascular remodel, metabolic dysregulation, type 2 diabetes, obesity. I can go on through all. Those are my concerns. It's not the width of the palate that you'll learn in a man. And when you start learning how to talk to the patient, when you start learning how to measure it quantitatively and qualitatively, which is a requirement, then it becomes very clear. You cannot be treating a patient for hypertension if you don't know how to measure it. And it's the same thing with the comorbidities in airway. You can't just start doing treatment because some patient says that they're narrow or you think that they're narrow. And so I think it's going to work itself out as we work together in spreading the word. That's part of the reason why we have this podcast that's for the provider and who doesn't even understand this, but they're hearing more about it. And for the patient that doesn't want to be harmed and really wants to understand the problem better. And you can't scale this like you can in DSO because it does require really engaging the patient and spending time. And we're not used to doing that in healthcare. Whether you're a physician or a dentist, you're super efficient. You come in, you sign out your papers, you come in, you're out, and you're doing treatment. Your treatment plan. You can't do that with Airway. You have to really get down to old-fashioned, taking a history, really understanding morphology, function, and interfacing with the medical colleagues and other colleagues. It's a very different way of practicing the way we are now, and it's almost a throwback to the way we started practicing, even 50 years ago. So I'm going to say that the commercial interests have really created the marketplace has really created a lot of confusion. Now, social media is just blown that up. Make sense?
Absolutely does. And I wanted to go back a little bit to the dentist out there listening that says, okay, guys, I want to take an airway course. And so I'm just Googling or I'm putting it in one of the AI interfaces and I'm coming up with this course, that course, or the other. That a lot of them are confused. They get the sleep medicine kind of passion. They want to go that direction. I've even heard of some dentists that want to learn how to treat airway that will even go into oral facial pain residency program, expecting to become elevated to the airway expert level, which of course that's not the curriculum. They're going to be sadly disappointed. That's not the way it works in those programs. I mean, what I mean, obviously, we could say, look, come learn from us, and that'll be the greatest course you'll take. But if someone was looking for a course, what are some red flags that they'd want to avoid to not, let's just put it bluntly, not waste their money on something that really isn't going to be sustainable and really isn't in the best interest of the patient? I mean, what would be a red flag, you say, in a course that would that someone might discover? Maybe they don't want to come across the country to California. They want to stay in wherever they're in the East Coast or something. So, can you talk about that a little bit?
I think a real good benchmark to ask yourself first is, are you comfortable in your understanding to speak fluently and confidently, locked eyeball to eyeball with a high-level patient that might be a healthcare provider themselves, to talk to them in a way where they understand that what you are recommending doesn't end up in an eye roll because they think that they're being sold something. If you think you're going to take a weekend course and start with a widget and you're not feeling fully confident that you can really measure an outcome other than do a technique, but actually measure an outcome that's tangible to the patient, then I think you need to educate yourself. And one of the things that I know that after you go through what we teach, that's the emphasis. Is first of all, you can't talk to the patient about it until you really understand it deeply. Beyond, and I'm not talking about learning about sleep medicine because it's not about sleep medicine, because sleep medicine by and large absolutely misses the point. Just as a side, sleep medicine as a specialty is a dying specialty. They cannot even fill the fellowships all over the residencies with candidates, and because it's really not a compelling specialty in medicine yet. It kind of peaked in that now, and I can tell you conversations I've had with well-known sleep physician pulmonologists that are really frustrated with it as well, and the reasons for that. So I'm not talking about being able to talk comfortably about something like sleep medicine, which is what the American Academy of Sleep Medicine really tries to do in training you. It's training you really to make fancy widgets, right? It ends up in a widget.
Mm.
So ask yourself, can you feel comfortable in being able to address facial aesthetic, smile design, occlusion, and a TMD, and all the things that we as a dentists talk about in with an airway focused lens? And if you can't, then you really have to learn how to do that in a way, because ultimately, at the end of the day, if you don't have patients driving and flying for you to treat them because they know you really understand the problem, you are going to just burn out. You're going to spend a lot of money and you're going to lose interest, and it will be a fad. Yes, it will be a fad, because it's not really airway. So I think that's kind of a question to ask yourself. Hey, can I sit down and start talking and explain? Can you give a 60-second elevator speech that's cogent and it's pithy, where the patient goes, I need to know more. Please, doc, you're the person. And I could tell you, you can't do that if when you're sitting down with a patient, you take their history, you talk to them and say, hey, you need this widget to make your wider, right? To make your mid face wider. Well, what are you going to do with the lower jaw? And what are you going to do with, the anterior posterior deficiency? Do you know the difference? What are you going to do with the child that already has vertical maxillary access, or that's bedwetting, or that has reflux and is being treated, and no one knows how to treat them? Because it's the same thing whether you treat kids or not. You have to understand where the problem starts. And if you are just treating kids, you have to understand what that child will turn into if you don't recognize it properly. So I think the challenge in airway is that we tend to revolve around a very specific segment of the population. With an airway focus, you really have to understand that entire timeline and work with the team, if you're not willing to do it yourself, to work with and understand the entire timeline. And this is not a matter of jack of all trades, master of none, where you're just treating very superficially a lot of different people. No, it's really not that at all. It's just really understanding the airway problem. And I just don't think that most people, even the gurus, truly get it. I can count on one hand how many really understand it. I mean, as far as like the gurus or whatever. But anyway, I don't know if that makes sense, Rich, but
Yeah, I mean, so really, if I would say a red flag, if am I'm a dentist that wants to learn more about this. A red flag would be to take a course that advertised uh, how to treat, sleep dentistry. That might be a red flag. It would be
yeah,
for me, knowing what I know. Another one would be a course that would advertise the use of an appliance to expand somebody. Like that's
yes,
the first course. Come take this course on airway, where you will learn. And then the first thing they talk about is actually the widget. Um, to me, I think that should be a red flag to anybody.
Well, let me add
Um,
one more since you brought it.
yeah.
Another one is that was a fad, digital smile design.
Oh, I know.
That whole group now is has already stated that if they're not involved in Airway, they will become obsolete. They will become irrelevant. They already have, because ultimately, why is that? It's not about the smile. That was completely missed. It's about the face. So if you're a provider out there, think about it. People really want to look better. They want nice smiles. If you're looking at just the arrangement of teeth and how that you've missed the boat. It's you have to understand how to read the face, how to diagnose the facial skeleton, of which the teeth and how they're arranged and the display and the proportion are only a part of it. So the data that you gather in diagnosing and providing a beautiful outcome that also results in a healthier patient requires you to really understand airway and really understand how to treat the facial skeleton. So ask yourself, if you're going to be treating or taking a course in airway, you have to have a real good understanding of the facial skeleton, how it develops, how it goes, how it develops aberrantly, how to correct it, and then the functional aspects that cause these problems. So those are some questions to ask, but the red flag from a dental point of view is if you're just focusing on teeth and how white they are, you're really missing the boat.
Agreed. Agreed. I was kind of blown away recently. I don't know if this is maybe another lesson of the week, but a patient was telling me about her grandkids, and the parents had taken, and the kid, it's like they got one of each problem in this family with these kids in terms of airway, seriously, affected individuals, these kids. One of them with ADHD, one of them, with acting out, another one with VME, and all of them were told by an orthodontist, "Come see me when all of their permanent teeth are erupted."
Right.
I mean, for me, I
Well,
can't even believe that
because
is happening.
but that's standard. So that's standard. Let's
But
maybe
Mark, wait, Mark, when we graduated 40 years ago, we knew about phase one orthodontics. We knew about growth guidance. We knew, even if it was wrong or misguided a little bit, it was at least an intervention
facial
in ways to,
orthopedics is what it was
yeah,
called. Yes.
absolutely.
Right. So again, because straightening teeth is very expedient, efficient business model. Why would you change? Because people
Mhm.
are demanding what they don't know. They're actually demanding a service that's oftentimes going to make them sicker. And this is where the orthodontic specialty is up in arms. They're fighting this. They're twisting in the wind. And I'm sorry, you're wrong. And that's becoming very clear from the medical community, not from the dental. And that's its own podcast. But let's maybe end on a couple of things. The comments I'll say is that what you just said has been a standard for a while now regarding waiting till the mixed dentition. And part of it is because the dentist does not want to deal with the patient, does not want to deal with the um, compliance issue. And it's under the guise of, I don't want to burn them out. So we're going to let the facial skeleton grow the way it's going to grow, and then there's not going to be enough space, but we could fix it by extracting and straightening the teeth. And that creates a problem. And there's a whole
Of
generation
course.
in our country that's suffering from that. But one other red flag, one last red flag, if we can end on this, is if you're taking a course on tongue tie and tongue
Yeah,
releases and
sure.
doing a weekend course on doing surgery for tongue tie, red flag, danger, Will Robinson, for those of you that are
Yeah.
old enough to understand that comment. It's because If you have a CO2 laser, you take a course, everyone on Monday is going to need a tongue tie release, and you understand very little about it because the tongue tie is only one part of a very complex system called the hyomandibular kinetic chain, which of course we talk about it in the fascial system. And a tongue tie is indicated in a small percentage of them, truly. There are other things that can be done less invasively, more predictably, and so that's its own discussion too. So I think with that, I think we've covered a lot of ground here, Rich, and
Yep.
look forward to our next podcast to continue the conversation.
It sounds great, Mark. I'm looking forward to it too. I'll see you
Okay,
soon.
all right, sounds good.